Welcome to the Hashimoto's Doctor podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hey guys, hope you're doing well today. This is Dr. Shook, and we are going to be discussing a very exciting topic. I think something that everyone needs to know about, because this topic in particular and the information I'm going to share with you, most people can apply this to their life. The majority of people can, and it can make a profound difference on your health, and it impacts so many different aspects of your health. It can help you to lose weight if that's a problem, but more importantly, one of the things that really caught my attention, the reason I'm talking about this today, is the connection between this topic and cancer, inflammation, and even autoimmune conditions. So I was looking through, I'm constantly online searching and looking at research that comes up, different topics that I find interesting that might help the people that follow me with thyroid conditions, autoimmunity, higher inflammatory loads, and people that are just trying to optimize their health. So what I came across was something that was really interesting to me. It stood out, and something I want to share with you guys. And this is the connection between fasting and decreased cancer recurrence in women that were non-diabetic breast cancer patients. Okay, so let me just repeat that. I found research that talks about a connection between fasting. That means going longer than, they were looking at going at least 13 hours between your last meal of the day and your first meal of the next day. Okay, going longer than or at least 13 hours showed a decrease in recurrence of breast cancer in non-diabetic breast cancer patients. Okay, so it showed a decreased recurrence of 36%. Okay, so basically when women went longer than 13 hours, they went at least 13 hours, they had breast cancer in the past, but they were non-diabetic. Whenever they went and they utilized what we call intermittent fasting, and they went at least 13 hours between their previous meal and their breakfast the next day, they had a 30% decrease risk of a recurrence of breast cancer as compared to women with non-diabetic breast cancer patients that did not fast. So the important thing here, and this kind of ties into some information I've been exposed to rather recently as well. It ties into the fact that blood sugar levels seem to feed cancer. Okay, so higher blood sugar seems to be something that feeds cancer. And what they also found was they looked at some inflammatory markers. They looked at C-reactive protein. They looked at hemoglobin A1C. C-reactive protein is an inflammatory marker. Hemoglobin A1C is a measure of 3 months of blood sugar fluctuations. Okay, so over the past 3 months, if your blood sugar's gone up, spiked up, your A1C will be higher. It's a much better way to look at blood sugar fluctuations over time than to look at your fasting glucose, okay, your fasting blood sugar. So they looked at these two markers, and they found that in these women that fasted, they had lower glucose, they had lower A1C, they also had decreased inflammatory load. Now, so all these things are definitely, they point to, some of the mechanisms that fasting is having, or some of the mechanisms behind the benefits of fasting, I should say. But what you also can learn from this is that we know that those things, blood sugar that's fluctuating up and down, we know that a high C-reactive protein, which is an inflammatory marker, all of those things are associated with worse outcomes, or we see people that have those levels that are higher do not do well with Hashimoto's or any autoimmune condition. It's very difficult for people to lose weight that have higher A1C, that have higher inflammatory load. We see higher C-reactive protein associated with all kinds of health problems, guys. I mean, I could go on and on and on. I mean, you may have heard me say this before, and this is so true. Most degenerative conditions, most chronic disease processes, they have inflammation as an underlying driver behind a lot of the damage that is being done to the body over time. I mean, when you start looking at at things like Alzheimer's, dementia, Parkinson's, all of these neurodegenerative conditions where the brain is actually degenerating, we look at that and we know that there's an underlying low-grade inflammatory process that's contributing to generation and loss of neurons or nerve cells of the brain. So here's really the take home for you guys. Fasting is an incredibly powerful tool. It's an incredibly powerful tool to harness the body's natural ability to heal itself. There are a few caveats and things that you need to be aware of. If you have problems with low blood sugar, then it's probably going to be an issue for you. You don't want to jump straight into fasting. Most likely, if you're having problems with low blood sugar, you're not going to want to jump straight into fasting, okay? Because it can cause you to have more difficulty stabilizing your blood sugar. Now, at some point, you should be able to begin incorporating fasting into your dietary regime and be able to do well with it. There's just a lot of people that have hypoglycemia that need to start working on stabilizing blood sugar by eating regularly and by addressing whatever the underlying factors are. A lot of people have adrenal gland problems where they have adrenal fatigue and their adrenal glands are unable to produce cortisol at a steady rate to help them maintain their blood sugar. Okay, because cortisol, that's one of the effects. Cortisol will help you maintain blood sugar. And that's made by the adrenal glands. And if the adrenal glands are exhausted, then you're going to have problems maintaining adequate cortisol levels and blood sugar. So we've got to make sure that people that want to attempt fasting, that they're aware of this, because you can't just jump straight into fasting if you already have problems maintaining blood sugar and your adrenal glands are exhausted and cannot maintain those levels. So I wanted to share that with you guys because I think that's a really important exception and caveat that you have to consider. So it's a really powerful tool. I want to share this with you guys because it's something that we utilize clinically that I think can help people, make a tremendous difference in your health, but we have to do it the right way. So I wanted to discuss that with you, share that with you today. If you guys have questions, comments, please let us know and just reach out to us and we will help you as much as we can to give you more information and give you some guidance. But I appreciate you guys, and I look forward to talking to you again very, very soon. Thank you for joining me on the podcast, and I hope this helps you to improve your health. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.